Seafood is an important part of the world's diet. Over 1 billion people rely on seafood as their primary source of protein. Without a doubt, seafood is nutritious. However, seafood also contains mercury, which can be harmful. So is it safe to eat seafood? In a word, yes. But it is important to make wise choices, especially if you're pregnant. Why is there concern about mercury in the first place? The toxic potential of mercury was tragically brought to light in the 1950s. A factory in Minamata, Japan was discharging chemical waste directly into the bay where people fished. It was an environmental disaster. The mercury waste contaminated the fish, and the people ate the fish. The mercury caused severe neurological damage, especially to the children born to pregnant women who ate the fish. We know that mercury in fish was the cause of the problem, but we also know that essentially all seafood contains some mercury. And people who eat lots of fish, as they do in the Seychelles Islands, are healthy, with no neurological problems. How do we explain the difference? To understand why mercury can be so dangerous in one situation, but cause no harm in another, it's important to understand how mercury, chemical symbol Hg, moves through the food chain. Mercury is a heavy metal, so it's not intuitive to think about it floating around in the atmosphere. But thousands of tons of it are emitted each year from natural sources like volcanoes and industrial sources like coal-burning power plants. When mercury settles in the ocean, bacteria convert it to methylmercury, which just means a carbon group is attached. Methylmercury can start working its way up the food chain in a process called bioaccumulation. Bacteria are eaten by plankton, plankton are eaten by fish, and when we eat the fish, we eat the methylmercury the fish ate. But fish are also good for you. That fish did not eat a caterpillar. That's an omega-3 fatty acid, a type of nutrient which is associated with healthy effects on your cardiovascular system. Omega-3 fatty acids are also important in pregnancy because they help with fetal neurological development. Fish also contain an element called selenium. Small amounts of selenium may actually be protective against methylmercury exposure. Methylmercury is harmful in large doses. In Minamata, an estimated 27 tons of methylmercury was dumped in a bay that is nearly surrounded by land, where it bioaccumulated in marine life. Samples of fish in that bay had methylmercury over 100 times what would be expected. On the other hand, omega-3 fatty acids are good for brain development, and selenium may actually protect against methylmercury. Obviously, there's a big difference between tragedy and good health. The good news is that good health tends to win out. When comparing the benefits of long-chain N3 polyunsaturated fatty acids with the risks of methylmercury among women of childbearing age, maternal fish consumption lowers the risk of suboptimal neurodevelopment in their offspring compared with the offspring of women not eating fish in most circumstances evaluated. That's a convoluted way of saying that mothers who eat fish are more likely to have healthy children. How did the World Health Organization arrive at this conclusion? They compared the benefit of the fatty acids to the negative effects of typical amounts of methylmercury in different kinds of seafood. The only caution is for the fish that are highest up the food chain. Big predatory fish like mackerel, marlin, swordfish, shark, and some tuna species might have enough mercury to outweigh the benefit from the fatty acids. There are plenty of other seafood options like shellfish, shrimp, salmon, tilapia, crab, trout, etc. that are much lower in mercury. So if you have choices, it makes sense to choose the safer ones, especially if you're pregnant. You can go to the EPA website to find specific advisories on fish in your area. To quote the New York City Department of Health, "Eat fish and choose wisely." Fish are a great source of nutrition, even for pregnant women, maybe especially for pregnant women. To be safe, choose fish that are lower in mercury and eat a variety of kinds. Thanks for watching.